Hello and welcome. This is Health and Wellbeing. I am Lois Abasambu. As Nigeria struggles to contain the spread of the dreaded COVID-19 in the country, yet another disease is ravaging the country rapidly. Cholera has been a known disease in Nigeria due to the dilapidated infrastructure and underinvestment in potable water. From the month of May to June 2021, the FCT reported 91 suspected cases of cholera and 7 deaths. The outbreak is spreading fast across the country as the NCDC recently revealed that a total of 14,343 suspected cases of cholera were reported from 15 states and the FCT, with 325 deaths from January to June this year. On the program today, the first Vice President of the Nigerian Association of Resident Doctors, Dr. Arome Adejo, joins us to discuss the cholera outbreak in the country. Dr. Adejo, you're welcome.
Thank you, Lois.
And it's nice having you here.
Thanks so much. Good evening to our viewers.
Well, we're going to go on a break, and when we return, our discussion will commence. Do stay with us.
It is with a deep sense of responsibility that I consider this an honor to be with you at this launching of the single largest vaccination program ever in the history of Federal Capital Territory to herald our decisive victory over the COVID-19 pandemic. As I stand before you, I took my job on Saturday, and I'm still standing hale and happy. This is a demonstration to make us know that at least we have about 72 hours from then till now. And I am standing to speak to you, not just to convince you, but also to encourage you that vaccinations have always been doubted wherever in the country. If today they are to bring back polio vaccines, I know some people will still say no to it. But at the same time, we have not, so far, by the grace of God, seen any casualty in Nigeria. And I will also share with you, just like I will encourage you after your own job, to please go to the portals and fill the forms to also share your experiences. But it's better to be safe. Please ensure you take your job to make Nigeria a COVID-19 free environment.
Welcome back, and thank you for staying. Before we went on the break, I told you we will be discussing the cholera outbreak in the country and how it affects us. So, Dr. Adejo, straight to the issues on point. I remember when we were small, we used to take a lot of mangoes, and anytime we took mangoes that we did not pluck from the tree, the first thing they tell you is cholera, like you're just taking cholera. And growing up, that was the impression I had of what cholera is. But I'd like you to tell us from the medical perspective, what is cholera?
Thank you, Lois. You just remind me of my childhood. Actually, cholera is acute watery diarrhea disease caused by the bacteria Vibrio cholerae. Cholera is a sign of inequality and a sign that a system is not developing. That's, in simple terms, what is cholera.
Well, that's in more scientific and medical terms. Well, I'd like you to break it down to us. What are the signs, what are the symptoms that one would see and know that, okay, this, when I have these signs and I have these symptoms, I'm down with cholera?
All right. Cholera, as I said, is caused by a bacteria. Now, what will happen is that that bacteria produces a toxin in your small intestine that allows water to be pulled from your body into the intestine. And when there is water in the intestine, what now happens is that you bring out the water out as stool. So that is what we call acute watery diarrhea. It's rapid in onset, and it's acute, it's watery. And the diarrhea is very plenty, that it can lead to dehydration and possibly death within 24 hours.
Within 24 hours. Now, one of the things I've heard so much about cholera is, apart from stooling, one also gets to vomit. What causes that?
Yeah, you know, Vomiting actually is a symptom of almost every infection, because when you take something into your stomach and it irritates it, the next thing you do, you try and throw it out. Okay? So it's the irritation of the stomach by the bacteria that makes you throw it out. And you see, once you are not well, you cannot absorb food. So once you cannot absorb food, so anything you take in, you throw out, either through your mouth or through the anus. Now,
how do people get infected with cholera?
Yeah, well, the major thing is through water and food. And that's why I said it is a sign of inequality and poor social development. In this 21st century, I don't think we should be talking of cholera again in this country. Because when there is an outbreak, it means there is no good and proper source of water. And it means that the food that the population gets access to is prone to contamination. Cholera is an infection that happens when there's usually an outbreak of war. Because when there is war, you cannot access potable and good water. And you cannot get good food to eat. So cholera is a sign of poor infrastructural development as a result of poor sanitation and lack of good water supply. That is just it.
Okay. So when people get down with cholera, and like you said earlier, like someone could die in the space of 24 hours if the person doesn't get help.
Depending on the severity.
Depending on the severity, yes. Now, what are home remedies or like first aids that people could actually treat themselves with when they begin to get these signs of cholera?
The main truth is that Nigerians, when you tell them home treatment, they take things to another dimension. So first and foremost, I will advise everybody that has this episode of acute watery diarrhea to seek medical attention, because so many things can cause acute watery diarrhea. But with cholera, it is frequent. It is frequent and it's mostly fluid. Now, at home, what you can do is that there is what we call oral rehydration salt. If you can have access to it from any nearby pharmacy, you can use it as prescribed. But if you don't have access to it, you can get teaspoon, get grounded sugar, take level of full teaspoon, level it down, and take 6 of it into a liter of clean or boiled water, then with half of the level of salt. So 6 teaspoons of sugar and half of salt.
So that's
put it in
6
1 liter
teaspoons
of
sugar, 3 teaspoons of salt.
No, 6 teaspoons, level teaspoons, not full. You level it of sugar. Then half of the level teaspoon of salt.
Oh, okay.
Then you put it in 1 liter of boiled water or clean water. Then you drink it. It's so severe that for an adult, you can need up to 6 liters of fluid. While for kids, you can need up to 1. But the safest thing is that whenever there is an episode of acute watery diarrhea, while you are taking fluid, rush down to the nearest hospital. Good hospital, not any hospital, because we have a lot of roadside clinics now, not manned by doctors.
True. So one of the things I realize is why cholera most times gets to the acute stage is because of negligence, and that's because over time, most times as Africans, we get used to not feeling fine and treating ourselves at home. Or sometimes you just get a few symptoms and we're like, okay, it looks like I'm having this issue, and so I'll just go for the nearby flagyl or the nearby Panadol or so and take it. But like, what are the major signs? Because normally when you eat food that your system does not accept, sometimes you stool as well, watery stool. But what are the symptoms that you would see that would make you know or think that this is not just the normal stool, this is cholera?
Now, anything you take that irritates the stomach, either you throw it out or you pass it out, it is a normal physiological response. Now, with cholera, the bacteria produce an exotoxin, a toxin that clings to an epithelial cells on the small intestinal lining, preventing you from absorbing water into your body, but encouraging you to bring out water from your body, and you pass the water out. Now, usually, with cholera, the episode is frequent, that is acute, instantly. Frequent watery stool. Watery stool is like when you wash rice, okay? You see, when you wash rice, the kind of cloudy water from the rice, that's why it is rice watery stool. The water. But you see, most times when you talk like this to Nigerians, they become doctors. So that's why I say, any episode of diarrhea, unexplained episode of diarrhea, even if it's explained, take yourself to the hospital. But actually, because of the fact that we don't have insurance in this country, and the primary health care are not strong enough, because diarrhea is not something that should be seen at the tertiary center. It should be seen at the primary health care level. So because of the weakness of the primary health care system, most times people tend to go to the nearby chemist, which is wrong, and get treatment. And maybe they just pump you with an antibiotic. And most times, antibiotics is not usually the first line of treatment. It's fluid replacement. Fluid, because you pass it stool out, is a physiological response. But when the volume of stool is too much, we try to stop it. Then you replace the fluid being lost, because it is the fluid that makes you weak. You pass out, you become dehydrated, it shuts down the renal system, and you go into acute renal failure. Most times what kills them is dehydration and acute renal failure, because when you are dehydrated, water moves out from your brain, from your body, from everywhere into the intestine and pass out. So the rate at which you pass out the fluid is more than the rate at which you take fluid. In fact, at times you can't even take fluid because you are throwing up. So that's why you just have to go to the hospital, where where the doctor can pass a line. But most times, okay, cholera, it is asymptomatic, or if at all there is symptoms, there is only mild to moderate symptoms, which with basic fluid replacement, you can be okay. But when there's an outbreak like this, there's usually the severe symptoms that will usually lead to death. And I said, any sound health instance, cholera should not cause an epidemic. Any sound health system should not cause an epidemic. There is an epidemic because of the inequality. And you see, I went to the Nigerian Center of this thing website, and I saw a lot of lovely write-up about it. But the truth is, you don't need all that. What you need is health education. I've been listening to radios, no jingles, nothing. That average man on the street, that guy in the camp, does not have access to phone that will go and check their website. You have to make sure that there is massive health. You go out, you do jingles. Let the public know that there is a problem now. And how do you prevent it? You prevent it by making sure that you take good water. You prevent it by making sure that what you eat, you can trust what you eat. Go to the central area. You see some restaurant close to where people pass through. And meanwhile, we have environmental that all they do is to go and look for people that park wrongly so they can bribe them. These are their work. They should not allow vendors, food vendors, to be selling close to these areas. So the right thing is not being done. That's why you are seeing this kind of epidemic. And it's the shame that 15 states, including FCT, is involved in this present epidemic.
Now, we're going to talk about the prevention of cholera and what we can do as well as individuals and as the government. But that will be our next line of discussion when we come back from this short break. Do stay with us, and when we return, our discussion will continue. Welcome back, and thank you for staying with us. Before we went on the break, I've been here with Dr. Arome Adejo, and we've been discussing the cholera outbreak in the country. And before we went on the break, I said we're going to talk about the prevention and what we can do, one, as individuals, and what the government can do. First, I'd like us to start with, you started anyways, but I'd like us to talk extensively on that. What can we do as individuals to prevent this? We've heard of treatment, we've heard, but we need to get to the point where we understand that prevention is better than cure, prevention is better than treatment. What can we do as individuals to prevent this?
Well, in public health, okay, the first element of prevention is to prevent yourself from getting in contact with the source, with the reservoir. So the first major thing that every individual should do is to make sure that your source of water supply is a trusted source, is to make sure that you take good quality water. Unfortunately, we have a lot of sachet ones now that we don't even know where the source is from. And that's why the quality control of this product has to be top-notch. The people that are entitled, the people that are supposed to maintain the standard of water in this country should do their job so that the water available to the population, to the citizens of this country, should be good and quality water. Now, you should make sure that your water supply is a good one. You should make sure that where you eat is a trusted source. You should not go to any roadside food vendor. You understand? People that put tent by the side of the bush where you see somebody doing something else and buy food. You know, when you drive along Abuja, you see some people at the middle of the road doing something. You understand? These are the things that should be prevented by the environmental agency. So people should know that sanitation, proper sanitation, access to pipe-borne, good source of water, and be careful of what you eat are the hallmark of any cholera prevention. So you remove yourself from getting access to the source. Then the next thing is that if you have access to the source by mistake and you are down, you should make sure you rehydrate yourself. You prevent the complications. That's the secondary line of prevention in public health. You prevent yourself from going down with renal failure, from being dehydrated. Take a lot of fluid and rush to the nearest standard hospital where a confirmation of cholera can be done. Most cases, because of the immunity we have, you see that we have mild or no symptoms at all. And these people can be a source of potential carriers. Because even if you don't show symptoms, you can be able to transmit it, secondary transmission, for up to 10 days. So the major source is we should make sure that there's enough health and education out there that will let the average citizen, the people in the village, my grandmom and granddad, know that to prevent cholera, you have to make sure that you boil your water. If you don't have access to good quality water, boil the water and allow it cool. Make sure you store it in a very clean and good can. So the major source of infection is water, then food, then environment. So that's why I talk about sanitation. So these are the primary prevention. Then the secondary one is, once you are done with it, you make sure you replace the lost fluid as quickly as you can and rush down to the hospital to prevent complication, to prevent death.
Now, you spoke about it being as a result of inequality in the society, and like I said earlier, the sources of potable water is almost at the minimal in the country generally, and that's why we see it rapidly spreading. I feel it's very rapid. Imagine in a very short period of time, we have the amount of cases that we have, the amount of deaths that we have. It doesn't even give you so much time to be able to recover and recoup. Now, talking about that is because it's more systematic. It has to do with the structure. What can the government do, or what should the government do to make sure that cholera is dealt with in this country?
Well, that question should be for the government officials, because I know they know what they should do, but they are not doing it. And that's why I say it's a sign of inequality. You are supposed to give good quality water to people in Duse Alaji, to people in Buhari, not to people in central area. The people in central area are big people that can get a borehole dug in their house. But when you go to the suburbs, you see that there is no good source of water. People dig well close to the soakaway. Yes, the rain fall and wash it, and wash the surface of the soil into the well, and people still drink from the water. You see videos online of people drinking from the same stream as cows and goats and donkeys. So the government know what they are supposed to do. They should make sure that every area, every rural area of this country is supplied with good quality water. If there is no water supply there, dig a borehole. Dig a borehole, industrial borehole, and make sure that this borehole is supervised from time to time by the environmental and health official. What are they doing in the ministry? Is it by speaking English online that this and this and that? No. Practicalize what you are saying. So a lot of Nigerians don't have access to quality and good source of water. That is the main thing. And if you look at these areas where you get these things, it's the rural areas. You can hardly get someone that lives in Maitama or in Asokoro that will be down with it. No, unless if he mistakenly goes somewhere and he doesn't have access to the usual one he drinks at home, and he buys pure water, the normal pure water. You understand? So the government should make sure that every area of this country has good water supply. If the pipe burn, if we don't have water, the normal water, the pipe water, you dig a borehole. Dig a borehole. These people are paying taxes. We are all paying taxes. Water should not be a problem in any sound government system. That is the truth. Water, these are the things that every citizen of a country is entitled to. It's a right. Good water supply, electricity. But we are not talking of electricity. Let's talk of the water, the source of this infection. Because water source can infect people more than any other source. So the IDP camps, the rural areas, they should have access to potable water supply, dig borehole, and the Standard Organization of Nigeria should make sure that they control the quality of water being sold out there. A lot of waters, a lot of bottles, something are fake. There are some I can't buy, but I don't want to call names. They are fake. That means people that are in charge of this, they're not doing their work. All they're after is what they get from these industries. And government should always hold people accountable. When there is a source for an infection, you put up inquiry, set up a committee, but at last they won't do that. All they're after is what will benefit me and my family. So that is the problem.
Well, thank you very much, Dr. Adejo, for taking our time to be here with us on health and well-being. But before we leave, I'd like you to give a word of advice to people out there on what they can do and what they should do in taking care of themselves.
Well, as a word of advice, I would tell every Nigerian that you shouldn't think of what the government can do for you. Think of what you should do for yourself. You should not hope that the government will bring quality water supply to your place. As a community, you can come together, bring something, ask for any industry or companies around your area to donate so that you can be able to get a portable source of industrial or dock in that area that can supply the entire community. Hold your leaders accountable so that they can provide water for you. But you or yourself, make sure you don't drink water you don't trust. Make sure you eat from where you trust. Or if you don't trust that place, make sure that the food is hot. And if you don't have access to clean, portable water, make sure you boil your water before you take it. And it is unfair if you give your children water you don't trust, because cholera kills the kids more than the adult. So my advice is for the parents out there to make sure that any water they give to their kids should be properly boiled. Thank you very much, Dr. Adejo. We sincerely appreciate your presence on health and well-being. We hope that next time when we call, you will still take our time to be here. My pleasure, Mom.
Thank you very much.
Thank you.
Well, that's the size of our package today on health and well-being. Do remember to boil your water before taking it if you do not have access to good, clean, portable water, and make sure you eat from sources that you trust. Do keep it to date with us same time next time. I am Lois Apasambo. Do stay safe.